Every surgeon's worst nightmare. Sarah Ortiz discovered her mother needed emergency brain surgery, and she was the only doctor skilled enough to save her. Success meant everything. Failure meant losing her mom forever. The phone call came at 3:22 a.m. while Sarah was reviewing patient files in her office at Metropolitan General. The caller ID showed Mom, which was unusual. Her mother, Elena Ortiz, rarely called this late unless something was seriously wrong. Sarah, mija. Her mother's voice was slurred, confused. Something's wrong with me. I can't remember where I put my keys, and my head hurts so much. Sarah's medical training kicked in immediately. Confusion, severe headache, speech difficulties. The symptoms painted a terrifying picture. Her piercing blue eyes scanned her schedule as she spoke, already calculating how quickly she could get to her mother's house. Mom, I'm coming over right now. Don't drive anywhere, don't take any medication. Just sit down and wait for me. The 20-minute drive to her childhood home felt like hours. Sarah's hands gripped the steering wheel as worst-case scenarios played through her mind. At 68, Elena had always been healthy, active, independent, the kind of woman who still insisted on cooking elaborate Sunday dinners for the entire extended family. Sarah found her mother sitting on the living room couch, staring blankly at family photos scattered around her. Elena looked up when Sarah entered, her expression showing a flicker of recognition mixed with profound confusion. Sarah, what are you doing here so late? The neurological examination Sarah performed confirmed her worst fears. Altered mental status, unequal pupil response, loss of coordination, all signs pointing to increased intracranial pressure, likely from a brain hemorrhage or rapidly growing mass. The ambulance ride to Metropolitan General became the longest journey of Sarah's life. Dr. Ortiz, the emergency room attending physician, doctor. Michael Chen approached her as Elena was rushed into imaging. The CT scan shows a large subdural hematoma with a significant midline shift. There's also what appears to be an underlying mass, possibly a tumor that's been bleeding. Sarah studied the scan images on the monitor, her professional training warring with her terror as a daughter. The blood clot was massive, pressing against her mother's brain tissue with potentially fatal pressure. Without immediate surgical intervention, Elena would die within hours. "Who's the best neurosurgeon on call tonight?" Sarah asked, though she already knew the answer. Dr. Chen hesitated. "You are, Sarah. Dr. Patterson is in surgery with another emergency, and Dr. Williams is out of town. The nearest available neurosurgeon is 3 hours away." The implications hit Sarah like a physical blow. She was indeed the most qualified surgeon to perform the complex craniotomy her mother needed. Her success rate with similar procedures was among the highest in the region. Under any other circumstances, she would be the obvious choice. But this wasn't any other circumstance. This was her mother. The ethical dilemma threatened to tear Sarah apart. "I can't operate on my own mother," Sarah said, her voice barely steady. "It's against medical ethics." The emotional involvement, the potential for impaired judgment. "Sarah, doctor," Chen interrupted gently. "Your mother doesn't have 3 hours. The pressure in her brain is increasing. Without surgery in the next 60 minutes, we're going to lose her." Sarah stared at her mother through the glass doors of the emergency bay. Elena was unconscious now, her breathing shallow and labored. The woman who had worked 2 jobs to put Sarah through medical school, who had celebrated every achievement and supported every dream, was dying while her daughter wrestled with protocol and procedure. In that moment, Sarah realized that all her years of surgical training had led to this impossible choice: follow medical ethics and watch her mother die, or risk everything to save the person who meant most to her in the world. "Prep OR2, Sarah announced, her voice regaining its characteristic authority. "I'll scrub in." "Sarah, are you sure about this?" Dr. Chen asked. "If something goes wrong." "If something goes wrong, at least I'll know I tried," Sarah replied, her blue eyes blazing with determination. "She's my mother. I'm not losing her without a fight." The next 3 hours became the most emotionally grueling surgery of Sarah's career. Standing over Elena's exposed brain, Sarah's hands moved with practiced precision despite the tears that periodically blurred her vision. Every cut, every suture, every delicate movement carried the weight of a lifetime of love and the fear of irreparable loss. "Suction," she called to the surgical nurse, her voice steady despite her racing heart. "I need better visualization of the bleeding vessel." The mass beneath the hematoma was indeed a tumor, benign, thankfully, but its location made removal extremely risky. One wrong move could leave her mother paralyzed, unable to speak, or worse. "Mom," Sarah whispered as she worked, too quietly for the surgical team to hear, "you taught me to be strong. You taught me to never give up. Help me save you." As if responding to her daughter's plea, Elena's vital signs stabilized. The bleeding was controlled, the pressure relieved, the tumor successfully removed. After 3 hours of the most delicate surgery imaginable, Sarah had done what seemed impossible. She had saved her mother's life. The real test came when Elena opened her eyes 12 hours later. "Sarah?" Elena's voice was weak but clear, her eyes focusing with recognition and love. "Mija, what happened? Why am I in the hospital?" Sarah took her mother's hand, feeling the warm squeeze that confirmed what the neurological test had already shown. Elena had suffered no cognitive or motor deficits from the surgery. The woman who had raised her was going to be fine. "You had a medical emergency, Mom," Sarah said, tears flowing freely now. "But you're okay. You're going to be okay." Did you take care of me?" Elena asked, somehow knowing the answer despite her confusion about the details. Sarah nodded, unable to speak around the emotion choking her voice. Elena smiled, the same proud smile she'd worn at Sarah's medical school graduation. "I always knew my daughter was the best doctor in the world. Now I have proof." 3 weeks later, Elena was back to cooking Sunday dinner, telling everyone who would listen about how her brilliant daughter had saved her life. Sarah never spoke publicly about the ethical challenges of operating on her own mother, but the experience changed her in fundamental ways. She understood now that medicine wasn't just about following protocols and maintaining professional distance. Sometimes it was about having the courage to risk everything for the people you love. Dr. Sarah Ortiz, the blonde surgeon with piercing blue eyes who had always defined herself by her professional achievements, learned that her greatest success would always be the 3 hours she spent saving the woman who had given her life meaning. Sarah Ortiz's decision to operate on her own mother reminds us that medicine is ultimately about love, love for healing, love for humanity, and sometimes love for the people who shaped us into who we are. Her story shows us that the greatest medical challenges aren't always technical, they're emotional. If Dr. Sarah Ortiz's most personal surgery moved you, subscribe to the Frontline Voice for more real stories from the medical world. Hit like if you believe love sometimes requires us to take the greatest risks. Tell us in the comments, would you have made the same choice Sarah did? Share this story with someone who understands that family is worth any risk. Until next time, remember that the most important operations happen not just in the OR, but in the heart.